we still have some of the concerns with insurance and reimbursement. That's one of the areas I think that is the common denominator between all of our clients is healthcare reimbursement, and the struggles to get reimbursed is just the common thread. And I wish there was a simple solution to fix that all the way through. And maybe that is where we start, with some simple low-hanging fruit that we can fix. But it takes so much work for a clinician or an institution, facility, practitioner to get paid. They're not doing what they love. And what they love is caring for the patient and making someone feel better. So we're trying to find middle ground and solutions. Some of the things that we've talked about in the past, Gold Card, for instance, was really trying to simplify something that was really being done. So when a provider, a physician, is really doing a good job and they're getting like, quote, prior approved for a different procedure, and they're every time 95% or more, they're getting reimbursed. The insurer's like, well, you don't have to keep going through those hoops. Let's give you a Gold Card so that you can continue to do that without the prior approval and the extra paperwork. That's an example of a solution. But that's something that actually helps the insurer as well, because then the insurer doesn't have to go through all those prior approvals through their extra staff, and the same thing happens for the physicians, because patients will get better care and outcomes if the insurers are making it easier for the physicians. We don't have really easy solutions right now, and every time a piece of legislation comes out, it's usually heavy on for one or the other, whether it's the insurer or the provider. And then we end up, in what we do, trying to negotiate pieces of this out instead of starting with a solution and building the legislation or some ideas from that. How do we start to really deal with that? And I think insurers, I think everyone, really needs to come to the table to make that happen.